I got into medicine because I enjoy working with people, taking care of people, and the science behind that. Um, it's something that has it's a career path that I saw myself drawn to since I was honestly a little kid. Um, my dad was a doctor. He talked a lot about his job. He would take me to the hospital with him. Uh, and I think I was always kind of exposed to it and was just continually drawn through it through high school and college. I went to medical school in Philadelphia at Jefferson Medical College and then did my residency at University of Miami. I came to Emory to do my fellowship in pediatric urology after residency. And as far as pediatric urology, um, I in my training, my time in pediatrics just was I really enjoyed being around kids. I think the issues that we deal with in taking care of kids are really um, satisfying as a doctor to address because they're problems that maybe the child where something was just did not develop correctly in the child, and you have the opportunity to really fix that issue in a way that is going to last the kid for the rest of their lives and work well for them. So it's as a doctor, it's very satisfying to um, have these diseases that you have treatments for that work well. I've been in Atlantis, let's see, for 10 years now, and I love it. I knew a good thing when I found it when I came here to do my training. Um, Throughout your training, you are in a lot of different medical situations in different hospitals and treatment settings. And it was pretty great here. The group also of other doctors was really awesome to work with. Looked like a really great group of colleagues to join. I have three kids. That takes up 98% of my time outside of the hospital. In the other 2%, I enjoy cooking. I enjoy getting outdoors. I actually cook just about every day. Um, and we try to get outdoors, whenever we can, whether it's going hiking or even something as simple as getting around town outdoors. Throughout my residency and fellowship, I published quite a bit. I always enjoyed asking questions and using the resources available to help answer those questions. We're really fortunate in this group that our practice has been around for so long that there's a huge patient population that we have to work with to help answer those questions. Since fellowship, I've helped our practice become a part of a national spina bifida patient registry with the CDC that tracks about 40,000 spina bifida patients throughout their life to help better understand how we can take care of those patients. We're also part of a group called the DSD TRN, which is the Differences in Sexual Differentiation Translational Research Network, similar to the National Spina Bifida Patient Registry. We aggregate these patients who have diagnoses that are pretty rare to help better understand how to care for them. There have been a handful of other publications that I've been able to do over the years since fellowship with our research fellow. There's some things that really distinguish our practice. We're U.S. News and World Report top 10 pediatric urology program for the last few years. We operate exclusively out of the Children's Hospital, which guarantees top level pediatric care from an anesthesia and other subspecialty standpoint. Our practice also has the longest running pediatric urology training program. And we're affiliated with Emory University. We have a consistent track record of research with several world experts in their field within our practice.